diagnostic workup, and whether you're going to be using organ motion data to look at your GTV, and how you're going to be defining the GTV by actually looking at the convex hull of all of the motions from your 4D imaging, or you're going to be expanding the CTV, and how you're going to be looking at the ITV. All of these things have to be defined up front. And then beam parameter selection and dose calculations. And then you also want to look at the uncertainty evaluation for that particular patient. What are the uncertainties? Because as I said, that when you are imaging a patient, it's a static 3D reconstruction of a patient's 3D volume. And now you know that is going to be moving. And as a result, you have to do an uncertainty analysis, which is based on the patient's your knowledge of how the patient's uncertainties are going to play into that particular treatment plan. And then delivery data documentation, preparation, and aperture and compensator fabrication, and patient-specific QAs, and all that. So here is another situation where you have to look at the anesthesia needs, because if a patient, especially proton therapy is very useful for a pediatric patient, and most of the pediatric patients are going to require anesthesia. So what are the things that you need to be looking at? What type of motion you have? And what type of tumor regression monitoring going to be doing, or for repeat imaging studies? And what are you going to be doing any adaptive proton therapy for that particular patient? All of that things have to be decided a priori for each disease site, and then implemented on a particular patient. And I'm going to go through a scenario which Dr. Zufang Li went through for a couple of disease sites while we were going through this delivery.